Now, YouTube is full of hospital packing lists, but today I want to tell you 3 things that a lot of people don't bring to labor and delivery that they wish they had. These aren't the most important things, but they are things that I think a lot of people don't think about, but can be really nice when you are in labor. And of course, I am the person who is balancing bringing things, but also not having to unpack your entire household when you get home. So it is always a balance. I actually have a whole hospital packing list that you guys can grab on my website. I'm going to link it down below for you. It's going to be super helpful to give you just the basics. Now, the first one is a portable fan. This can look a lot of different ways. Honestly, just bringing like a hand fan to just fan your face, that can be helpful if it's just a short period of time. I a lot of times am fanning people like when they're getting an epidural or during the contraction, I'll fan them. And a lot of times I'm just using like a laminated piece of paper that we have in the room, or even our friend at the cervical guide over here. So that can be helpful for short term. There are those small rechargeable fans. I actually bring those to Disneyland frequently. They're just a small fan that you can hold in front of your face. But I'm telling you that the gold standard that I've seen a lot of people bring is a portable USB chargeable fan. Now, the good thing about this is it has this clip, which means it can clip onto your patient table. It can clip onto your side rail if the side rails aren't super, super thick, but it can just be there and then just blowing on your face. Let's see if I can Beyonce this. This has no power. So I was going to Beyonce myself, but I actually take this on my cruise ship now. I hook it onto the bar and I dry my swimsuits with it when we're on a cruise ship. I have taken it camping. This thing can be so, so useful. So don't think that you're just purchasing it for labor. It can be really handy in other times. Turns out I need to go charge mine right now. But a portable fan can be awesome. Now, some hospitals actually have little fans in the rooms for all the different patients. This can be a good question to ask when you're on your hospital tour. I actually have a whole podcast episode on hospital tours, so I'm going to link that down below for you guys. But a portable fan can be really, really helpful. And that guy I think is about $15. But even if you don't have that, just a hand fan, or if you have a little rechargeable fan, throw it in your bag. You're going to find it really helpful. This is actually from a post on my website that I made. So if you're looking for links for fans like that, it is in the post. I will link it down below. And if I remember, I might even put the affiliate link for that kind of fan right down there. So you can just look at it and see how expensive it is today. Okay, the next one, which is something I saw so many people not bring, and it is washable footwear. Now, the hospital is going to give you these sad little grippy socks. They give it to every patient that is admitted to the hospital because they do not want you to fall. Fall risks are a huge thing in the hospital, and they want to make sure that you have grippy on the bottom of your feet so you don't slip if the floor is wet. And I'm here to say that the floor gets wet really frequently in labor and delivery. It can be from amniotic fluid or after you have your baby. Sometimes those first few times you get up, you might leak a little bit of urine, and blood sometimes comes down. So it's really important that the footwear be washable, meaning that if blood drips down, we can wash it off or throw it away if you're just getting the dollar store flip-flops. I will also say those grippy socks get stretched out. They twist on people's feet. I always feel bad for them. So if grippy socks sound nice, you might want to just bring some grippy socks from home. You can get them at any big box store. And again, I have links for all these different things down in the comments. You can get a cheap pair of knockoff Crocs for really inexpensive, and I think they would be super handy. I know a lot of people don't love the idea in showering at the hospital with standing barefoot on the floor, so they can be used in the shower as well. I'm a big fan of them. I mean, you can 100% go barefoot too, but I can't tell you how many people I saw trying to put like their shoes that they brought from home on as they tried to get up to the restroom, and then amniotic fluid was dripping down their legs. I'm just here to say, bring some footwear that you would either be okay to wash or chuck. Those are our 2 different options. And if you have favorite socks, please do not bring them into the birthing room. I can't tell you how many patients' socks I've just thrown away after delivery. Things get real dirty down there. So it's something to keep in mind. But of course, I also don't want you to fall. So try and decide which one works for you, kind of like a birth plan. What do you like on your feet normally? I am generally a barefoot girl, so I would just want ones that I could slip on and off really easily as I climb into bed. But you might be a person who likes socks on their feet or something like that. So think about what you like. If if you're like, I love this idea of thinking about what I would like in labor, I actually have a full free birth plan mini series just going through the different things that you might like in labor. I'm going to link that one down below as well. The last one is some labor movement cards. And you're like, Hillary, why in the world would I need those? And I'm here to tell you that just like my daughter just took her AP calculus test yesterday, you get into that test room, aka the delivery room, and all of the knowledge just like washes outside of your body. You have no idea what Romeo or Juliet said when the test is on Romeo and Juliet. Once you get into that stressful situation, it can be really hard to remember all of the different things that you've learned at home. And so these labor movement cards can really help incorporate movement into your labor, which I think is so important. And it helps when all of that information just washes out of your head. The labor movement cards that I recommend actually come in the bundle. They also give tips for your partner to help you move and different times to use different movements. Of course, if you forget your labor movement cards, and I just had a friend who was in labor the other day and she was saying, well, every time we move, we have to ask the nurse to come change the monitor. And I'm here to tell you, tell your nurse, I would love to move more during my labor. What can I do to incorporate movement into my labor and still try and keep this baby on the monitor if both of those things are important to you, which they would be important to me as well. So making sure that you're incorporating movement. If you have any questions, you can always bring that nurse in to help you as well, because they love to MacGyver things, but sometimes they got to get asked because not every patient really wants to move. Some of them just want to lay there in bed, and I'm here to tell you that isn't going to be as helpful as moving. Those birth cards come in the birth class that I recommend. I'm going to link it down below for you. Now, these aren't the most important things. I actually have the big 3 in a video that I'm going to link up above and down below, but thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth, including what goes in your labor bag. I gotta ask, what did you bring in your labor bag that was super helpful? Tell me down in the comments. I would love to know.